Greetings, dear viewer. You are very much welcome to my YouTube channel, Health Awareness Tips with Dr. Mercy Kalenzi. And today I want us to share about some of the common causes of reduced vision. Well, people tend to take their time when it comes to seeking health care attention related to eye care. And for a very long time, people stay in the villages, stay in their homes until they are in end stage eye disease, when actually sometimes there is nothing to do. And it's for this reason that I've decided to share about some of the common causes of reduced vision. Like, you could be there asking yourself, why is my baby having reduced vision? Why is my baby not seeing very well? Why is my dad, who has hypertension and diabetes, not seeing very well? I have a child who has, for example, sickle cell disease, and I don't know why they are not seeing. I don't know, they were otherwise okay. And you could be there, you have a baby who had severe malaria or any other cerebral related diseases, and then after the illness they stopped seeing the way you were expecting them to be or to see. So today I'm deciding to share so that we get acquainted with this knowledge, so that it's important to seek medical attention when you know or you have this kind of knowledge. And if you know that it's your very first time to watch my videos, please subscribe, hit the bell icon, so that every time I upload a new video, you will be able to see. Thank you, and stay alert. Number 1, refractive errors. Refractive errors are some of the most common causes of reduced vision. And you may have what you call myopia, short-sighted. Then you could be having hyperopia, long-sighted. You could have astigmatism. Then we have some kids actually around 5 to 15 years that tend to have a lazy eye. We call it amblyopia. You find that you had a problem with your eye. Say you had a cataract when you were young and it was treated at a very late age, and then you developed amblyopia. So it is important that you know those history is important. Another thing, cataracts. Cataracts commonly affect the older people. That is what we can call age-related cataract. But also, if you have history of trauma to your eye that is not treated very well, you can tend to have a cataract because you have inflammatory uveitis, and from then you get a cataract. But also there are kids who might be born with a cataract. We call it congenital cataracts, and these babies actually are born with it, and maybe the midwife sees and tells the parents who don't care so much. So it is actually comes back to the first day of delivery. If we talk about cataract, when your baby is born, pay attention to what your midwife tells you as far as examination of the newborn is concerned. If they tell you there's something wrong with the eye, seek medical attention, because when it's not managed very early, you tend to get what you call amblyopia, a lazy eye. So kids tend to have that kind of the reduced vision that is related to that disease. Another thing, there's what you call glaucoma. Glaucoma is the #1 cause of irreversible blindness. It's painless, you never know, but you wake up one morning and you are in darkness, or you go for routine checkup of anything related to an eye pain, and when they examine your optic nerve of the eye, they actually tell you that you have glaucoma. And because it's a painless disease, patients don't pay attention. They give them start doses of treatment, you go home with your treatment, and because you have no pain, you never come back. 5 years later, you wake up, you are in darkness. So glaucoma is #1 leading of irreversible blindness, and therefore painless blindness. And therefore it is important that you come to know that it is possible that you could actually have this kind of disease. And when you are told, please take the treatment as advised. Another cause of blindness Before I finish glaucoma, it is important that you know about the family history, because this kind of disease runs in the family. You find that your brother, your uncle, one of your great grandparents suffered from a blind or died blind, and you guys didn't know. So when you actually know that you have history related to glaucoma, you need to begin screening your children or your relatives when they reach at least 25 years and above. If possible, at least go every year and you screen your eyes. Another thing, we have what you call diabetic retinopathy. Diabetes is a very, very bad disease that affects almost every system of the body, and the eye is not exceptional. And it also tends to be painless. You wake up and you are also, well, its vision loss tends to be gradual over time. But for patients who have type 1 diabetes, then they have higher chances of developing diabetic retinopathy when they are still young, because they have lived with this disease for a very long time. And the risks are very high for patients who have, the risks are very high for patients who have poor controlled sugars. Another thing, hypertensive retinopathy. Hypertensive retinopathy comes from long-standing high blood pressure. High blood pressure is a very bad disease that once it's long-standing, and especially for poorly controlled patients, then it tends to affect your eye, giving you what we call hypertensive retinopathy. That disease affects the retina, which is the sensitive part of vision. So, and actually, patients who have high blood pressure are at the risk of what you call stroke of the eye, where one of the blood vessels of the eye gets blocked. It could be the whole of it can be blocked, or it can have a branch that is blocked. And therefore, if you actually high blood pressure that is poorly controlled, know that you are at a high risk of becoming blind because of the hypertension affecting your eye. So it is important that you know about that. And actually, it is a wake up call that when you wake up and you have high blood pressure and it's not well controlled, and you get a stroke of the eye, then it is shows you that you have a high chance of getting stroke that is affecting the whole body. Another thing, we can also have reduced vision that is related to sickle cell disease. Sickle cell, also long-standing sickle cell disease, can also affect your retina and therefore leads you to reduced vision. So those are the major and the most common causes of reduced vision. I would like to encourage each and everyone to take heed of routine healthcare checkup, including your eyes, because people go to check for their lungs, for their heart, and other parts of the body, but they never think of the eye. And just to mention, let me remind you, the eye is an essential organ of the body. You cannot see a bright future without an eye. So you need your eye for anything beautiful you would want to see. So take care of your eye, because it's very, very traumatizing to live or take care of a blind person. Just take an example. You have like loose motions, and you need someone to hold your hand to take you for a short or long call. You know how troublesome that can be. I know people who are living with patients who have blinding disease or who are already blind. They know what I'm talking about. It's really, really very challenging taking care of a blind person, and therefore caring and ruling out any causes of blindness at an early stage of the disease is very important, because when you know, then you can manage them. In the next video, I'm going to share about how we can manage some of the things, and but the most important thing is seek ophthalmologist review. You can see an ophthalmic clinic officer nearby who can refer you for further management, but at least go for routine checkup and do what you have been advised to do. Otherwise, thank you all for seeing my videos, for watching. leave in the comment section any questions, any inquiries that you could have about this video that you could want to know more about. And until next time, thank you for watching. Do not forget to subscribe. Thank you.